Hello all, welcome to the ACRE at ANU student presentation session. We acknowledge and celebrate the first Australians on whose traditional lands we meet, and we pay our respect to the elders past and present. My name is Sneha and I'll be chairing today's session. Today we have 3 student presenters with us and 2 judges. So Dr. Bev Rogers and Mr. Tan are our judges for today. We have the speakers Amna Rafiq, Kayla J, and Pranujan, who will be presenting today. And the title, as everyone would know, for today's session is Reviewing the Literature on Cancer. So our first presenter for today is Amna. Please start when you're ready.
Hello everyone, this is Amna Rafiq from University of Veterinary and Animal Sciences from Pakistan, and I'm going to present on prevalence and etiology of breast cancer in Asia. So as an introduction, normally what happens in our body that our cells divide after a certain time and new cells are produced, they replace the older cells. In cancer, this controlled division goes uncontrolled and growth and then spread of these abnormal cells actually damages our body. And if this condition is not treated properly, this can result in death. Cancer is one of the leading cause of death in past few years, particularly in low and middle income countries. If breast cancer is, as much as we are concerned about breast cancer develops in the female breast tissues. Speaking about statistics, last year in 2020, breast cancer exceeded the lung cancer, and now it is one of the most prevalent cancer worldwide, with almost 2.26 million cases reported and almost 700,000 deaths reported last year. So just imagine, breast cancer, a female disease, is more prevalent than lung cancer, which was previously the first most prevalent cancer, which affects equally men and women. So why Asia? We conducted this study around Asia because Asia comprises of almost 60% world's population, with most of the low and middle income countries. So we designed a systematic analysis. In systematic analysis, we are actually focused on Asia with assessing all and collecting and analyzing all the previously reported studies, and our purpose is to provide a summary of all the previous primary researches addressing our study question, that is prevalence and etiology of breast cancer. We also focused on the mortality. So we assessed 4 databases strictly adhering to the data entries from 1990 to 2021. We designed first 5 search terms: breast cancer, epidemiology, etiology, risk factors, and Asia. We actually paired them differently and assessed 4 databases, that is PubMed, PLOS ONE, ScienceDirect, and Biomed Center. Our inclusion criteria were all the full text articles, English were available in English, and based on observational study design. No intervention studies or any study that included any diagnostic tool or treatment approach were included in these studies. Also, we strictly adhere to the original articles, no review articles, any kind of review articles were included. And speaking of etiological factors, we actually categorized all the etiological factors in 6 categories. These actually pretty much cover all the parameters of our life: demographics, reproductive factors, gynecological, hormonal, genetic, and then lifestyle factors. And then this is the prisoner flow diagram of our systematic review. First, when we conducted the research, we obtained 4,43,564 researches, but these are not all the relevant researches. We actually put them on different filters to screen out the most relevant and eligible studies for our research. So by first filter was screening based on the title. So by screening based on the title, we got only 349 studies comprising on the Asia. And after removing duplication using an EndNote software, they were left only 298. These 298 studies were now eligible for full text reading. And after full text reading, we got with only 56 studies that actually addressed our study question. All the excluded articles were either non-Asian, or they were review articles or diagnosis or treatment based, or also those that give a qualitative analysis as a result. So these 56 studies were now eligible for this study. So we assessed them for the quality analysis based on Newcastle-Ottawa scale. Newcastle-Ottawa scale is a study tool to determine the quality of the research article. So according to this tool, 40 were of good quality, 15 were of average, while 1 was of poor quality. Coming to results, as much as we were concerned about prevalence and mortality, not all studies actually addressed them properly. Only 7 studies properly addressed prevalence, and only 2 actually included mortality. So although it is a very small number, but these studies actually showed an increase in the trend of disease in past few years. This is actually consistent with what WHO says. So then ecological factors, we actually then divided them in modifiable and non-modifiable factors for easy explanation. Modifiable factors are those that can be changed and that we can work on, and non-modifiable factors are actually difficult to change. So in non-modifiable factors, these were the factors we came up that actually contributed in developing the breast cancer. Age was a very critical factor because most of the studies actually assess this age. So any female actually can develop disease after 20 years, but this peaks in 40s and 50s of their life. And family history and genetic mutations, particularly BRCA1 and BRCA2 genes, are obviously the important factors. Then age of menarche, particularly the younger age of menarche and the age of menopause, higher age of menopause, were found very much contributing. And menstrual status, particularly menopause, was very important when it came to developing breast cancer. Then coming to modifiable factors, education, higher parity. Actually, parity was found to be very much related. All the women that developed breast cancer were found to be either nulliparous or had one child. So higher parity actually acts as a preventive factor. Also, breastfeeding was critical. The lower the duration was breastfeeding, there were higher the chances. Then oral contraceptive pills, hormone replacement therapy. Here it is worth noticing that both oral contraceptive pills and hormone replacement therapies involves hormones. This is actually related to the age of menarche and age of menopause. But age of menarche and age of menopause shows us, it gives us a time frame of start of menstrual cycle and then the stoppage of the menstrual cycle. All the studies gave us that the wider this range is, higher are the chances of developing breast cancer. It is said that this is due to the higher exposure of ovarian or female hormones to the body, as breast cells are very much responsive to these hormones. So what we do in the oral contraceptive pills and hormone replacement therapy, we exogenously give those hormones to the body. So they also result in developing the disease. Then history of radiation therapy was found, body mass index, higher body mass index, particularly in postmenopausal women. And then low exercise, poor nutrition, and smoking, both active and passive smoking, both are found to be significantly associated with developing breast cancer. While assessing all these factors, we came up with these protective factors that actually help us prevent the disease. Education was very important. Even though it can't prevent the disease, as breast cancer is not a communicable disease, but education can help decrease the mortality. Then premenstrual status, being the higher duration of breastfeeding, higher parity, and physical activity, and healthy diet. Here it is worth noticing that as we all know, poor nutrition means high cholesterol food, fried foods. That meant here too. High cholesterol foods with fried food, grilled meat, etc. were found to be associated with developing the breast cancer disease. So I conclude this presentation with this note that non-communicable diseases, particularly the high increasing trend of breast cancer, needs serious attention. Also, there are a lot of extensive study gaps. Name a few: endometriosis, polycystic ovarian syndrome are hormonal imbalances diseases of females, and these are actually very prevalent these days. And oftentimes, birth control pills or oral contraceptive pills are used to treat them, as we already know that these pills are associated with developing breast cancer. So we need more studies to evaluate these issues to how they are related to developing breast cancer. And by focusing them, we can give more focus on modifiable factors and protective factors to come up with the preventive measures we can do to decrease the burden of this disease. Thank you.
That was a great presentation, Amna, and finished well in time. So I'll open the floor for any questions. So judges, do you have any questions for Amna?
So which software did you use to remove the duplicate result that you showed in previous slides?
We used, okay.
Yep.
Okay.
Yep, slide 6, yep. Which software did you use to remove the duplicate results?
We actually used EndNote software.
Yep.
Okay.
Dr. Bev, would you like to ask some questions?
Sorry. I would just say in, you know, if you had to say only one sentence, what would you say is the most important thing that you found out?
So doing this study, when we say that cancer, it is also mostly associated with genetic mutations and such factors. So while concluding this study, I can say that there are preventable factors. They are modifiable factors such as nutrition and healthy diets that we can work on. And these days, when we are already focusing the communicable diseases, non-communicable diseases with slight focus can be prevented, such as breast cancer, as scary as it sounds.
Thank you.
Thank you, judges. So the audience, if you have any questions, you can please put it in the Q&A. There's a button on the bottom. If you have any questions for our presenter, please do put it in there. Awesome. So as there are no more questions, let's move on to our next presenter. Thank you, Amna, for your presentation. So our next presenter is Kayla.
Thank you so much.
Start
I'll
now.
just share my screen, just a moment. Can everyone see that? Sorry. Yep, perfect. Okay, awesome. Good afternoon, everyone, and thank you so much for joining today. My name is Kayla, and I am a student at Western Sydney University, and I'm currently completing my Master of Research under the Nickham Health Research Institute. My research is specifically looking at gut metabolites and their anti-cancer properties against breast cancer cells, and that will actually be the focus of my thesis for next year, which is exciting. If you do have any questions today regarding the research or my presentation at all, you are welcome to contact me as well via these addresses listed on the screen. Today I'll be discussing the research I conducted at the end of 2020 in my final year of my Bachelor of Medical Science, in which I, with the support of my supervisors, conducted a systematic literature review on the association between gut microbiota and the 5 most prevalent cancer types. Now, the gut microbiota is a collective term for the 100 trillion microorganisms that reside in our adult human gut, and is inclusive of primarily bacterial species, but does also include viruses, fungi, and protozoa. Our unique individual gut microbiota composition is developed by physiological interactions between the host and the microorganisms that are introduced into our system by the external environment. Now, these microorganisms directly and indirectly interact with the host to regulate behaviors within the gut. Now, gut microbiota does play a crucial role within the human body in relation to the overall maintenance of health, but also in the onset of disease, including cancer. Your gut is directly connected to various body systems, including the central nervous system and enteric nervous system, which we can see here. And the bidirectional association between the gut and these systems constitutes what we call the gut-brain axis. Now, this axis secretes hormones and neurohormones to assist in the regulation of several metabolic and digestive activities within the gastrointestinal tract. In recent years, it has become increasingly evident that an individual's diet and other lifestyle risk factors are important in determining that composition of the gut microbiome. Disturbances to this population, known as dysbiosis, which we can see in this diagram here, can lead to the onset of disease, including cancer. Now, this is a representation specifically of the link between gut microbiota and cancer, in which we can see the effect that the healthy gut microbiota has on cancer outcome, as well as the effect of standard anti-cancer therapeutics on that healthy gut microbiota population, which can actually lead to that dysbiosis. Now, existing studies have observed significant anti-cancer potential from a range of gut microbial species, most predominantly in relation to colorectal or colon cancer, in which there is a strong connection between the gut microbiome composition and progression of this disease as well. Now, this observed link between gut microbial species and cancer is still a rapidly emerging and evolving area of cancer research. However, you will notice in this diagram, there's a couple of question marks indicating clear gaps in the literature in relation to the role of viruses, the type of gut microbiota-based anti-cancer therapies that could be produced, and those mechanisms of actions of the gut microbiota, which is a really big gap. Now, whilst the anti-cancer potential of gut microbiota has been well established, we really don't have a holistic understanding of these mechanisms of action just yet. And similarly, comprehensive reviews on the link between microbiota and the 5 prominent cancer types, which is colon or colorectal, breast, lung, prostate, and stomach cancer, are really limited in oncology research at this point in time. Now, given the clear gaps within the field, this review draws a comprehensive summary and assessment of the recent research conducted to identify the direct and indirect role of gut microbiota in these 5 prominent cancer types. In my talk today, I will be outlining the methodologies used in constructing this systematic literature review, the findings of the study, and why these findings are actually important in the broader context of the field. Now, for this comprehensive review, all articles published so far on the topic were searched using keywords in different databases, which included Medline, Embase, ProQuest, and Google Scholar. A total of 9,401 articles were screened from these databases, with 137 relevant articles included based on the predetermined inclusion and exclusion criteria for screening. So the analysis of the studies was carried out using the summarization of the information in the articles, such as author, year of publication, title of the report, information provided in the abstract, and the overall purpose of the study as well. These articles were then further analysed based on different aspects of our systematic literature review, including the key focus of the overall report in respect to gut microbiota and cancer, and also the main conclusions drawn from these studies as well. And the data extracted from these articles were the overall aim of the study, which was supplemented by the anti-cancer properties as observed by the various taxa on the cancer types, including the toxicity of these microorganisms, as well as the molecular mechanisms of action of these microorganisms. Now, as a key finding of this review, immunomodulatory and anti-tumoral effects of gut microbiota was observed across all 5 cancer types. Notably, the Bifidobacterium species and Akkermansia mucinophila correlated with favourable anti-cancer immune responses in animal models and humans. And additionally, anti-tumoral effects were observed by these listed bacterial species here via multiple mechanisms of action. So we can see that in this diagram here. This included cell cycle arrest and apoptotic cell death, which is a controlled form of cell death. We've got the induction of the anti-cancer immune response in the middle here, and we also had a suppression of the tumour, which obviously prevented further development of this tumour. Now, as well as this, gut microbiota did exhibit clinical implications through increasing the efficacy and reducing toxicity of the standard chemotherapeutics and other natural anti-cancer agents. Of particular interest, the Lactobacillus species was found to enhance the efficacy of standard chemotherapy against 4 of the 5 prominent cancer types, which included colon, breast, lung, and stomach cancers. This activity was supplemented by the probiotic bacterial strains, including Bifidobacterium, treating tumor-induced gut dysbiosis within the cell and other metabolic dysfunction as well, which we can see branching off in this diagram here. Now, in addition to the direct role of gut microbiota, these microorganisms were also found to exhibit indirect activity by regulating the activity of immune cells. Essentially, it was identified that gut microbiota produces metabolites and signaling molecules, which we can see in section A of this diagram, which essentially includes inosine and short-chain fatty acids, which regulates the activity of T cells, B cells, and natural killer cells against that tumor microenvironment via interaction with the axis. Now, in response to the gut microbiota, these cells types produce molecules that work to actually inhibit the tumor. In contrast, these species here were found to have pro-tumoral effects. The causative effects of these bacterial species occurred mostly via primary interactions with the tumor, in which they promoted tumor growth and formed inflammatory microenvironments. And other mechanisms of this action included activation of carcinogens, which are cancer-causing substances, and alteration and destruction of the host DNA via oxidative stress as well. So we have found that the gut microbiome has quite a close interrelationship with the host, obviously in relation to the immune system and other body systems. These findings essentially suggest that gut microbiota can be targeted and utilized to potentially improve the pharmacokinetic response of several natural anti-cancer therapies. And this review will directly inform future in vitro, in vivo, and clinical studies to further investigate that complex role of gut microbiota in different cancer types. Now, findings from these studies will define gut microbiota-focused preventative and therapeutic interventions for cancer. And as resident probiotic bacteria in the gut have shown efficacy in inhibiting tumor growth, probiotic-based anti-cancer therapeutics are actually currently in development to restore that gut microbial dysbiosis in cancer patients. Now, essentially, the long-term outcome of this research would include potential changes to clinical practices in the treatment of cancer, which could lessen the adverse effects and cost of treatment in those cancer patients as well. But future directions must prioritise investigating those molecular mechanisms of action as a primary focus. Thank you so much for listening. I'd love to address any questions you might have. And just a reminder that if you do want to contact me at all, you can do so using these contact details here.
Great, that was a great presentation, Kayla, and the floor is open for any Q&A that the judges want. So if the judges don't have any questions, we have a question from the audience. So the question says, could this lead to future clinical trials?
Yes, definitely. That is essentially the purpose. It's still a very new area of research. So primarily the focus is to conduct those in vitro studies within the labs, which can then obviously be conveyed into the animal models, which will give us obviously a better foundation to then progress on to clinical trials. So that's definitely the aim, but there's a lot of research that definitely needs to be done to show support for those clinical trials for sure.
There's another question. So do you think we could have gut microbe interventions one day? I think this would complement chemotherapies very well.
Definitely, very good question. So yeah, 100%, and that's also something that's definitely being looked at, the use of gut microbes and metabolites used in combination therapies as well. So alongside those standard anti-cancer therapeutics, but also coupling several species together, that's shown a lot of promise in terms of reducing drug resistance that we see with some standard drugs. And it's also essentially has less adverse effects on the patient as well, which is obviously a really massive thing for that chemotherapy treatment.
So there's another follow-up question. So are there any negative interactions between gut microbes and chemotherapies that we know?
Yeah, good question. So from the studies we've seen so far, there hasn't been negative impacts at all. It's more so just establishing if it's actually having a more beneficial effect by coupling them together as to having them separately. But to this, from what we've found in the literature so far, there hasn't been negative effects, no.
Awesome, that was great. So we have another minute if anyone has any other questions.
And just say it's a nice presentation, actually, well put together. I thought the slides were very nice. So, well, you know, nice diagrams. So it was very good. So thank you.
Oh, thank you so much. Yeah, I actually made them myself. So that means
wow,
a lot.
okay.
Thank you. Yeah,
Okay.
Thank you so much.
Great. Thanks, Kayla, for that awesome presentation. So we are at the end of our session. So thank you, Dr. Bev and Mr. Tan for being the judges for today. And congratulations to our student presenters for giving some great presentations. The recording will be available online after the conference, so you guys can check it out. And we hope to see you in the other conference sessions.
Thank you so much.
Yeah, thank you so much for organizing this.
Well done to everyone. I'm from Flinders University in South Australia, but I'm very impressed by what you're doing. Well done.
Yeah, well done. Very good.